still have with us Quezon Representative Helen Tan, and we are now joined by the Union President of the University of Santo Tomas Hospital, Donnell John Siazon. Donnell, magandang umaga po sa inyo.
Good morning, Miss Karen. Good morning.
All right.
Good morning, Congressman.
Hi, Donnell.
Yes. Let's get straight to the point, Donnell. Ano ang reklamo ng mga medical frontliners ng UST Hospital, Donnell?
Okay. First, for several months, Ma'am Karen, hindi po namin natanggap yung, actually years, more than a year na, hindi po namin natanggap yung meal, accommodation, and transportation allowance. Even yung pong compensations para dun sa mga nag-positive na mga patients po, na mga health workers po natin.
Oo.
Before pa ho mag-expire yung...
At ilan kayo? Let's give me the numbers. Ilan kayo sa ospital?
Na nag-positive, Ma'am Karen?
No,
or,
ilan ang staff ng ospital ng UST who qualifies for that?
Over 1,000 po.
1,000, okay.
Ako. Ang mga nag-positive po, I think parang mga nasa 280, pero ang nakapag-accomplish lang po ng mga requirements ay mga nasa 150 to be exact po. Unfortunately, we were able to provide all the requirements needed for the claims ng compensation before the expiration of Bayanihan 2.
Okay.
Unfortunately, hindi po kami nakatanggap even up to this time. At ang masakit nga po, sinasabi sa amin, we've been receiving messages coming from the CHD of DOH, Center for Health and Development, informing our health workers na nag-positive na their DOH still awaiting for the fund coming from the DBM. So that hurts kasi una, na-comply po namin ang requirement before the expiration of Bayanihan 2.
Yeah, oo. Tanong ko lang po, ang Special Risk Allowance po ba ng lahat ng qualified sa UST Hospital na ibigay po ito?
No, ma'am. Kasi it created confusions among our health workers. Kasi the first guidelines, ang sinasabi nga ho, ay malimit lang ito dapat sa mga may direct contact ng mga patients. How about those medtechs? They are extracting fluids, they are the one doing the swabbing, and even our mga radtechs. For them to do the procedure like yung portable x-ray na dinadala nila sa mga bawat bed sa mga COVID patients natin. Kulang na lang, yakapin nila yung mga pasyente to do the x-ray. Kasi from time to time, minomonitor po yung mga baga ng mga pasyente. And still, these are the allied professionals na hindi po talaga nakatanggap. And then, suddenly, kaya ko po sinasabing nagkaroon ng confusion, June 30, nag-expire yung Bayanihan 2. And then, nag-cut off ang pagpasa ng mga requirements for SRA ng second week of June. And then, June 29, nagbigay po sila ng clarification sa memorandum na sinasabi na dapat mabigyan yung mga medtechs. Kung June 29 po ito lumabas, second week of June pa ho sila nag-cut off, nag-deadline. So, wala ho kaming maisip na paraan para ma-include po sila.
Opo. So, ang tanong ko dito, Congresswoman Tan, let's start off with this clarification. Ito ang UST. They were able to submit all requirements before the expiration of Bayanihan 2. So that hurts even more. You complied, you gave all the documents needed. Tapos niyan, hindi binayaran. Unang-una, Congresswoman, when Bayanihan 2 was crafted, what was the coverage of Bayanihan 2? Ito lang bang dapat ay nurses na talagang nag-aalaga ng COVID patients, or how was the math done? How was it calculated? Sino po ba ang covered?
Okay. Meron sinabi doon na ang makakatanggap ng SRA is workers o healthcare workers in direct or close contact with COVID patient.
Not necessarily nurses alone.
Not necessarily, yes. Because you have the dietary, you have the...
sabi po ni Donnell, nagdadala ng mga makina.
Kain,
test, swab.
The rad techs, So I think doon ito yung pinagmula ng confusion. Nung pumuntas ang guideline, siguro pinadala ng mga CHDs to different hospitals, no, yung interpretation ng close contact, no, or yung who are directly caring, baka they're in the belief na baka nurses lang ito at saka doctor, parang ganon. Kaya they missed other employees, no?
Correct. Oo.
And then meron kasi silang parang tables na pinadala sa mga hospitals, and meron doon nakalagay sino lang talaga yung nagjo-duty doon sa kanilang COVID ward. So may miscommunication, Karen, actually. Nakita ko, number one, miscommunication, hindi properly explained sa ating mga health facilities kung sino yung mga possible na pwede namang pumasok doon. Kaya tuloy ang in-expect ng ating mga healthcare workers or mga workers in the hospitals or health facilities, lahat sila, they thought, will receive the SRA. Ganon ang expectation talaga nila.
Okay. I'm curious very quickly. Bayanihan 1 and 2 had SRA amounting to 9 billion, right? The DOH claims they've released that already. Were you able to check that in your hearings?
Yeah, they said they released that already in the CHDs, no? Nasa CHD
Okay.
siya.
So na-release na yon. Donnell, have you calculated, for example, in UST, how much does the DOH owe UST workers? Kasi the Alliance for Health Workers calculates SRA, meal and transportation allowance plus the life insurance. They calculate it to 38,000 pesos per head. Plus they have 9,000 members. So they had a number of 324 million. So I'm assuming some of your employees there are members of the Alliance for Health Workers, right? Pero sa
No.
UST alone, have you done the math?
Ma'am Karen, ito ngayon yung problema sa amin. Sa aming mga private hospitals, the DOH asked for a forum yesterday.
Yeah.
So ngayon, hindi ho na din namin ma-reconcile upon the explanation of the DOH doon sa meal allowance, accommodation, and transportation.
Yeah.
Kasi,
Has
according
anyone received 38,000 in full? Meron ba sa inyo?
that is, Miss Karen, that is impossible. Kasi,
Okay. Really? That's the calculation kasi ha. I'm not, that's not a random figure, Congresswoman. That's really the calculation of the SRA, meal and transport allowance plus the life insurance. All in one is 38.
Yeah.
Walang ganon? Donnell?
Wala po. That is
UST
perfect.
Hospital in Manila, in the center of NCR, has not received this benefit.
No, only SRA. Pero sabi ko nga po, medyo selected lang po yung ibang nabigyan.
So yung SRA, magkano po binigay? That's 227 a day.
A day.
So
Provided.
magkano yung pinakamalaki na natanggap ng SRA ng isang nurse? For example,
15?
15K. Okay. 15. Kasi nga wala yung ibang benefits. Walang meal and transport, wala yung life insurance, walang
Yeah.
ganon.
Wala po.
You've never gotten the life insurance? Not one
Never.
of you?
Never po.
Congresswoman, what is this?
After all the tedious requirements asked by the
Yeah.
DOH,
I mean, this is
we were
really...
able to comply all the requirements needed. Pero still, ito pa rin po. Parang ito po yung masakit na parang we're still begging up.
You're
even up.
begging. Yeah.
Yes,
It's
what is
that
due
thing-
for.
Yeah. Oo. Congresswoman, they're begging.
Yeah. But actually,
But they shouldn't even beg. It is
Yeah,
under
I
the
agree.
law.
I agree.
And then you have 11 billion pesos unutilized by the DOH in Bayanihan 2,
Yes.
unobligated.
I agree with you, Karen, no? Tama naman na hindi dapat sila mag-beg kasi ginawa ng Kongreso yan para doon din sa pagkilala natin sa mga health workers. So ang expectation ng members of Congress, ito ay maibibigay sa kanila, no? Kaya nga nakalagay doon, nakaspecify yung SRA, meal, accommodation, and transportation. Siguro yung sa DOH, naging passive sila, no? Hindi naging proactive doon sa implementation na okay, compute nyo na how much all in all and how many employees ang kailangan dyan sa hospital. So yung UST actually were given, I think, 8 million plus. I think, tama ba ako, Sir Donnell, no? 8.5.
Apo, nung first tranche po ng SRA, 6 point something, and then the second tranche, 8.5.
So 8.5, nakita ko yung data kasi nung nag-dialogue kami, Karen, with the presidents of the Employees Union, I asked nga DOH and NCR to submit. Ang nakalagay po doon na beneficiaries, total of 395. But this is for SRA only. Hindi kasama yung sinasabi nila na MAT, yung meals and accommodation and transportation. I think ito yung isang malalim na usapin. Then, kung papaano ba nila matatanggap, kung sana kinompute na lang natin ng fix, no? Let's say,
I think fix would have been, frankly, more efficient.
Yes, kasi parang ang ginagawa nila, the employees has to submit, number one, saan siya ang accommodation, halfway house. Diba, Sir Donnell, no? They need to comply pa mga documents. And for example, transportation, yung receipts of pamasahe mo, like that, they have to comply. So, yan yung nagpatagal ng proseso. Pero ako, paniniwala ko, let's say, kinompute natin each of the employees natin ng 15 plus 5 for transportation and insurance of let's say 1,000, they'll be getting 22,000 each of them. So to simplify the process, no, but we understand naman that they need attached documents for COA audit, no, yung for the audit ng ating DOH. But tingin ko pwedeng isinimplify siya at pinabilis ang implementation.
Yes, Ms. Karen and Cong, base sa explanation ulit kahapon ng DOH with regards to the MAT, yung meal accommodation and transportation, non-commutable siya. Ngayon, magpapasa ho ngayon yung management.
Pag sinabing non-commutable, I think you need to explain that. What do they mean exactly?
Para nga ang dating ho sa amin, wala ho kaming makukuha dahil ibibigay po ito sa management dahil si management ang nag-provide ng transportation, accommodation, meal. Pero
nagpo-provide ba ng meals sa inyo?
Accommodation, yes.
Yes, pero meals, are you free at the hospital?
Transportation, wala po.
Okay,
So paano ho namin i-reconcile ito? Kasi kung ito ay i-course through na sa management namin, so of course,
yes.
Ang hirap na, I mean, I'm not only speaking for UST. Paano yung ibang hospitals? Paano kung hindi na i-allocate din ito sa mga workers po nila? So at least kung ngayon pa lang may malinaw po na pagbabatayan po natin. So alam namin from our end, its workers, alam niya kung ano ang dapat na nararapat sa kanya.
So how would you fix this, Congresswoman? I mean, Bayanihan 2 has already lapsed. Senator Mig Zubiri says he used the words, it's BS if we make the law lapsing as an excuse. But then there could be technical issues. I'm just curious. Paano yun?
So kami sa Congress, what we're doing is oversight, no? Currently, proactive kami in conversation with the CHDs.
But where would you get the money?
Well, yung money, may savings naman. They were saying may savings, no, na po pwedeng gamitin. Kasi ang tama ka, yung reason is na revert back yung 18 billion, wala na siya. But they were saying naman na that DOH can always endorse to DBM, no? So baka meron naman talagang pondo, and I heard during the hearing na yung they're trying to compute the savings, no, ng DOH kung po pwede na gamitin talaga diyan sa kakulangan doon sa SRA. But siguro, Karen, we need to get the exact figure.
Yeah.
All in all, hindi lang, Karen, sa private hospitals in NCR, kundi sa buong Pilipinas. Kasi
Yeah.
may
And there is no data. That is what
Yes.
alarms me the most.
Yes.
Actually, Donnell, speaking with the Private Hospitals Association, there is no data in terms of just how many. At this point, they haven't collated data. How many medical frontliners in the private sector have not received? How much are we talking about? You can't seem to quote it in hearings.
Actually,
Yes, Ms. Karen.
Oo,
Pero
but ganon.
that can-
Last
that
words,
can
Donnell,
easily
no, we
be
are going
utilized.
over time, but I'll let you have the last word. And if you don't get it in 10 days, are you gonna go on a strike? May medical lockdown ba?
That we have to talk pa with other local unions pa. Pero yung 10 days, ito po yung problema ho namin. Saka gusto ko naming manawagan po ulit ngayon.
Oo.
If that 10 days na binigay po ng palasyo para sa BBM and DOH para mabayaran yung mga health workers, pwede ho bang, kasi as of yesterday, ang sinasabi ko sa amin, kailangan mag-comply na ho kami until tomorrow. Until tomorrow, na hindi ko namin alam kung ano yung mga dapat namin i-comply.
Ano pa i-comply mo? Nabigay nyo na nga lahat ng dokumento. Bago mag-expire ang anong complying?
Other claims pa, Ms. Karen, we have yung meal allowance and transportation. Up to this time, hindi pa ko namin alam. Kahit sana template lang, no? Mabigyan ko sana kami. Apo. Ngayon, kung maglalaps po ito tomorrow, paano ko namin, kung magde-deadline po ito tomorrow, hindi ko namin mahabol ito at maaaring mawala na naman ito sa amin. Pwede ho ba na manawagan lang po sa DOH na dapat ho i-cascade na ho lahat yung list ng requirements, templates, or whatsoever to different private hospitals so that at least by this time, the whole day for ngayon, baka sakaling mahabol po namin yung deadline until tomorrow.
Okay. On that note, Donnell, I want to thank you. I'm actually on overtime already, but I want to thank you for that. And I'll follow up with you soon. Congresswoman,
Thank you,
just
thank
a
you.
quick 30-seconder to close. What can you do to help them?
Well, sa Committee on Health, we're conducting
Quick lang,
naman hearing siya. We'll monitor the progress ng DOH, no? And na-mention ko naman kina Donnell, no, sa ating mga employees union that my office and the committee is always open. Ako personally, Karen, is nakatutok, no, which of the regions are moving and regions that are not moving. So
All right.
personally, I'm in monitoring the progress.
Okay. On that note, I want to thank you both for your time this morning. It's been a fruitful conversation.